the maxillary. So she's got 3 scoops of powder, 3 levels of room temperature water, mixing so that it's nice and smooth and homogeneous. So you mix and incorporate the water and the powder, and then spatulate along the side of the bowl to ensure that all you're getting rid of all the trapped air bubbles so that your material will be nice and smooth. This is why in dental materials you spend so much time mixing material, so that that part is easy for you when you actually have to start to take the impression inside someone's mouth. Okay, so now what we're going to do is we're going to do a smear technique with this technique so that you can see the other technique.
It's on your finger.
And so you're going to take the impression material. You fill the tray first. Okay, we'll fill the tray first. We're going to fill the tray from the palatal region of the tray. Now we don't have to wet our finger. Now we're going to take a little bit of extra material from the bowl. We're going to smear some up on the palate and some along the incisal and occlusal edges of the teeth. So she's smearing it in there. And then we're going to take the tray and insert the tray now from 11 o'clock position. So from 11, retract the cheek with the opposite hand, sideway entrance of the tray. Make sure you line up the handle of the tray with the middle of the nose so it's not off kilter. Push the posterior part and anterior part of the tray up. Get the lips up and around the tray. We can ask our patients to form the letter O around the tray to get that nice peripheral roll. And have your patient now tilt their head forward so that we don't feel like that's dribbling down the back of our throat. And continue to muscle mold with your thumbs very gently around the lips to get the peripheral roll around that tray. Ask your patient if they're okay, and if they're having gagging issues, to breathe real deep through their nose. Okay, if people are breathing deep through their nose, chances are they will not then engage in throwing up. Set, okay, so we can feel it, it's set. So now we're going to remove this tray. So an upward push of the handle, little slight side to side, easy removal.
Excellent. Good job.
Okay,
So.
and the one thing that if we could have had ready is a bowl so all that extra stuff goes out. And here we have a completed maxillary alginate impression. We want to be looking for those all teeth in place and that the material is smooth and that there's no air bubbles and no tears, just like we were evaluating the mandibular tray. We spray it, okay, wrap it in a damp tissue, and then seal it in a Ziploc bag until you can get to pouring it up. It should be poured up as soon after it's taken as possible so that there's no shrinkage of the impression material.